Thank you, Conrad. According to the World Health Organization, nearly 50% of people aged 12 to 35 years old could be exposed to unsafe levels of sound from the use of personal audio devices. Additionally, it's estimated that as many as 50 million people in the United States suffer from chronic, we had a debate over this, tinnitus or tinnitus. So here to tell us how we can avoid tinnitus is Nurse Christina Paris. So thank you so much for coming in today.
Yeah, glad to be here.
Yeah, so first off, let's just discuss the tinnitus. That's kind of what everyone says, but you were watching some videos, it seems actually pronounced tinnitus.
Tinnitus.
Very interesting. So.
Yeah. But most of us, you're right, know it as tinnitus, which is basically just hearing an auditory sound that isn't really there. So typically when it's really quiet, you may hear kind of a ringing or a swishing sound in your ear. And so what happens is when we hear sound, the sound waves travel through our ears into kind of our ear canal and into the cochlea, which is this snail-shaped thing inside of our ear. Then through those cells, it goes to the nerve endings, and the nerve endings go up to our brain. So what happens with tinnitus is that our brains are trying to find a wavelength that isn't quite there. So it's giving us a false sound.
Interesting. It's like elevator music for your ear.
Yeah, right.
So how is this diagnosed?
So it's diagnosed through, you go in and you see either an ENT, an ear, nose, and throat doctor, or you can go to an audiologist and they can do a complete hearing test, and there's different tests that they can do. Then depending on the type, like I said, you can get a pulsing sound, which is, some people will say, I hear a heartbeat in my ear. And you want to identify, is it just one ear or is it both ears? Is it constant or intermittent? You also want to identify if the frequency and the duration. So does it sustain for a long period of time, and is the frequency high or low? And so those are the things that you want to talk about with the audiologist, because pulsating or hearing a pulse in your ear could be an indicator of a cardiovascular problem. So you're actually hearing blood going through the blood vessels, and that's of course not normal, but it can occur with high blood pressure. It could be an indicator of a risk for strokes or other different things going on in your head.
It's interesting how our nerves, like, something up here could be a problem down here, like how they travel and connect like that. But how can tinnitus, like, what can cause that? I know you would ask me because I'm half deaf. I mean, you have a lot of hearing loss. You asked if that can, if that happens, but what are some of the other things maybe that
Depression can cause tinnitus or tinnitus. Also, you can get it if medications can cause it. Some medications, if you are having different, like we said, hearing loss, age-related high blood pressure, an overactive thyroid can also cause it. So there's lots of different things. So and then the cardiovascular disease. So yeah, if you notice these things, you want to go in and talk to your doctor about them.
Again, just back to the, how like one thing can signal a problem for something completely unrelated.
Right.
The human body is very weird. But
it is.
Is there anything that can be done to, treat this or at least help it?
So there are things. I mean, one, if it is a cardiovascular issue, by identifying what the problem is and treating that can sometimes get rid of the swishing sound. You can also wear hearing aids. So if hearing loss is the problem, get a good set of hearing aids. Antidepressants if depression is causing it. If it's an insomnia problem, then you can try melatonin or different things. Behavioral therapies. There's sometimes even masking. I have tinnitus, and so that's what I do. Like, I'll listen to background noises of like the ocean, or have the TV on in the background, different noises, so that when it's dead silent, I'm not hearing that ringing. You can do biofeedback, like meditation, things like that, to just relax yourself. Cognitive behavioral therapy, there's an electrical stimulation therapy that you can use. Uses like acupuncture needles, and electrical impulses can get spread. Acupuncture in itself, there's a magnetic stimulation that they can use. Sometimes herbal remedies too, although none of those are really, have been tested. But they do say that, like, Melatonin, like I said, can be one of the herbal things. Vitamin B's, zinc, copper, those things can
They
help.
kind of maybe more work to treat other things that could be causing it, not directly going
Right,
at the tinnitus.
absolutely. Yeah, because it's a frequency problem up there.
Right. So it seems some of the things aren't even necessarily just like to treat it, but to maybe even just make it a little more bearable.
Right. Sometimes, yes, right. Sometimes you absolutely cannot get rid of it. It's just part of who you are.
Yes,
So.
interesting. Well, definitely very helpful, to be aware of this. I'm sure a lot of people, again, have that ringing in their ear. I hear it sometimes, and I'm just like, can you just go away?
Yeah.
So very nice for people to kind of be aware, see some of the things they can do, and to know maybe it may just be beyond your hearing, and go get it checked out with a doctor if you notice.
Absolutely. And again, try to identify, is it both sides, one side? Is it intermittent? Is it constant? Is it the ringing or the pulsing and the swishing, So yeah, kind of having those things identified will help your provider to figure out what the problem is.
Perfect. Well, thank you so much for coming in today.
Glad to be here.
And coming up, we have what's trending in